So we're going to look into chapter 15. We're pretty much mid-chapter. Going to be looking at maternal physiological adaptations right after delivery. So moms are going to face quite a few hematological, metabolic, and physical changes immediately after delivery. And one of the first things that we see is an immediate decrease in blood volume. So moms have a significant blood loss, and they're, of course, primed with extra blood during pregnancy. So it's typical and normal for a mom to lose up to 500 milliliters of blood during a vaginal delivery and 1,000 milliliters of blood during a cesarean section. And so they also tend to have some big fluid shifts that are coming along and face some major diuresis in that first initial couple of days after delivery. And we'll talk a little bit more about that initial diuresis probably in a couple of slides here. So one of the other things that moms change in that hematological system right after delivery is really that white blood cell count. And it's normal for them during labor to have a spike in the white blood cell count where it's mildly elevated. And we expect that to continue for that first, almost up to a week after delivery. For that to be slightly elevated. After a week, we should be seeing it come back down into the normal zone. Also, during pregnancy, fibrinogen is also increased, and that is so that they're prepared to clot, correct? And so we do see that returning to a normal fibrinogen level over about 3 to 4 weeks after delivery. So one of the major changes that women face immediately after delivery is a huge shift in hormone levels. And this really comes from they've had this hormone-making placenta inside of them. And then suddenly we're taking that hormones placenta out, and it's no longer secreting all of those hormones into their circulatory system. And so really that estrogen and progesterone drastically reduce right after delivery. They also, that actual triggers a little bit of prolactin to come down to ready women for breastfeeding. But truly that whole loss of hormones is what really shifts into kind of a high gear for all sorts of physiological changes that are happening. So in addition to the immediate drop in estrogen and progesterone, you're also looking at some other drops, so circulating other levels, which might include the placental lactogen, the cortisol, growth hormones, insulinase, they all fall. So during that postpartum period, the levels in the serum kind of reduces the anti-insulin effects that occur during pregnancy. So therefore, insulin requirements right after delivery for most insulin-dependent women kind of get a honeymoon phase or a time period where they don't need as much insulin at that time. And for most insulin-dependent diabetics, their glucose levels will actually remain in a normal range without much intervention during that first few days after childbirth. All right, so looking into the neurological system, most moms will report a lot of difficulty sleeping even in those last few months of pregnancy, and that doesn't necessarily end. Most women complain of maternal fatigue. They're also then having to wake up multiple times to feed the baby. But even immediately after birth, some women can kind of be really exhausted and just go into fairly good slumber, but most women are so kind of emotionally wrapped up in this delivery that they then cannot sleep out of excitement and nervousness and adjustment to all of that change. It's not uncommon for women immediately post-delivery, especially if they've had anesthesia or analgesia for either a regular vaginal delivery or whether they had a vaginal bypass and having a cesarean. Not unusual for them to have some neurological issues still kind of pervasive in those first few hours. And really what we're talking about is numbness in the legs, heaviness in the legs. After vaginal delivery, if they've had some anesthesia, they typically need an assist of about 2 nurses to get them up to the bathroom for the first time. We don't utilize gait belts in obstetrical nursing, but we should be really providing for safety for mom, and we should be doing some, weight-bearing tests as far as can they push down on your hands with their feet? Can they pull up with their toes? And that will give you an idea if they've got some motor sensation. And oftentimes they'll still feel pretty heavy, is what moms will say. But you want to have two nurses there to get them up to the bathroom. Oftentimes when they've had a C-section, the difference is most of them will be in bed for several hours afterwards, and so they may have had a spinal rather than epidural, so they may have a little bit that may come and go in just a matter of minutes after that 2 or 3 hour mark, and they may go from really numb and to they can have good feeling and motion and good sensation. But because those moms who've had a C-section are post-operative, oftentimes we don't sit them up in bed until later on, maybe about 6 to 8 hours after delivery, and they may try standing or walking in the room within 8 to 10 hours of delivery. That's not a bad goal to reach for parents. So another neurological issue that we worry about and monitor for is headaches. It's really important if moms report headaches that we do a good thorough job of assessing the quality, the location of the headache, especially for those who've had an epidural or spinal anesthesia. They may get a worse headache after about 24 hours. It gets really bad when they sit up, goes away when they lay down, and how we treat that is it's usually spinal fluid that can be leaking at that time, and so we'll oftentimes treat with caffeine, so we may have them drink coffee, drink a Pepsi, lay down flat, and that's pretty much the telltale sign. As soon as they lay down completely flat on their backs, their headache resolves completely. Then they sit up to eat or they sit up to breastfeed, and boom, their headache just throbs and comes back. That's typically the sign that they're leaking some cerebral spinal fluid. Oftentimes our nurse anesthetist will go in, draw a little bit of blood from the arm, and then put that directly into the epidural space to plug the duct. And when they plug that with a little bit of mom's own blood, then that creates that seal over the epidural space, and that cerebrospinal fluid isn't leaking out of there as much. Sometimes if moms just have a general headachy kind of feeling, or they maybe feel a little bit floozy, it's kind of like it could be just kind of almost that jet lag that their body goes through from lack of sleep, giving birth, all of those exertional things. But another thing we want to carefully monitor them for would be any sort of headache that may be because of a change in blood pressure. And so really what we're looking for is, are they accompanied by double vision, blurred vision, any sort of like aversion to bright lights or photophobia, stomach pain, especially up in the epigastric region or underneath the liver area, proteinuria, although we don't really check that a whole lot postpartum simply because there's so much blood already in that urine. But what we worry about with these women is the findings of preeclampsia, and sometimes we don't always know that someone's blood pressure has crept up until right after delivery, and they can have kind of that late pregnancy preeclampsia, and then suddenly they can go into a seizure. And so that would be something to watch for. So we're going to check their blood pressure. We're going to check their neuro pretty carefully. When we're going to be, reducing stimulus, lighting, have them laying down on their left side oftentimes, and really just letting the doctors know immediately if they're starting to have signs and symptoms of what could possibly be a preeclamptic episode. Okay, so moving into the renal system, fluid and electrolyte balances in postpartum moms. We really do look at kind of a slow change over a couple of the 3 months of the return of the glomerular filtration rate, the creatinine, and mom's BUN returning to those pre-pregnant levels. So if you can remember, during pregnancy, everything kind of slows down a little bit, and those rates go down. They aren't as efficient, right? The kidneys have this overload of fluid that they're trying to process, and so they just aren't as well organized. So towards the end of pregnancy, some moms will have a little bit of proteinuria, like a +1 on a dipstick, and that can be fairly normal. And what we see is that over also the first few weeks, that proteinuria starts to go away. And we look at this rapid, sustained loss of fluid that happens immediately after delivery. In this loss of fluid, people are actually losing sodium as well, and new moms will have this what we call natriuresis and diuresis, meaning that they are losing both the salt and the fluids, and they're just kind of shifting it right out of those intracellular spaces and shifting that into their circulatory system and then out of the body. So not uncommon at all for women immediately after childbirth within the first 24 hours to have 3,000 milliliters of urine out. That seems like an amazing excessive amount, but even for a mom, the first void or two after delivery, not at all uncommon for her to have a 500 to 1,000 milliliter void. And this kind of insensible almost fluid loss that happens right after delivery typically will even happen with moms who've had a C-section. And sometimes we'll see that in the form of urine output, and sometimes we'll also see it in the form of moms will just become profuse sweaters, and they just sweat that first couple of days. So not just the urine output, but also the sweating. It is important to let moms know ahead of time to expect that amount of fluid loss. Otherwise, they get just a little bit worried about it. But really, within a few weeks, we should see moms kind of fluid and electrolyte levels return to a normal baseline. Okay, so one of the things most women towards the end of pregnancy are so excited for is the relief on the respiratory system. It's just amazing how quickly, once that baby comes out, the uterus goes down, that moms feel that decrease in the intra-abdominal pressure. Suddenly, all that difficulty that they've had breathing, all of that dyspnea, all of that struggle to get a good breath in, suddenly now their lungs can expand, and it just feels like relief to them. So it's not uncommon at all for you to see their respiratory rate actually slow down a little bit. I usually say, you are looking to make sure they're breathing, but that 8 range is probably 8 to 12. They should be right about there. And it's not unusual at all because suddenly now their whole diaphragm can expand, and they just kind of relish in the ability to breathe deeply again. All right, so skin changes and looking at integumentary system, lots of hormone alterations causing those skin changes during pregnancy. Most of those begin to disappear shortly after birth. Takes generally a couple of months for all those integumentary system to kind of clear up a little bit. And if you'll remember, some of those changes were like the mask of pregnancy or the cloasma, the linea nigra that goes from the pubic line up to the umbilicus and a little bit past that. But one thing that doesn't always change or fade is oftentimes the striae gravidarum, which are the stretch marks. Unfortunately, those are usually there to stay. But it is important not to tell moms necessarily that those are there forever. Sometimes it's just important to say that those will fade over the next few months, year, and shouldn't be such a drastic change from their skin color. Okay, so for cardiovascular system, lots of big changes here, especially as we're fluid shifting, and it's not unusual for moms to be fairly unstable cardiovascularly directly after birth. They go through these huge hemodynamic changes. It's very dramatic. They expel the baby, they push out the placenta, they lose a lot of amniotic fluid, they lose a lot of blood oftentimes. Again, it goes through here, 500 milliliters for vaginal delivery, 1,000 for a cesarean section, any more than those two numbers for those two different types of deliveries, and we do call it a postpartum hemorrhage. But mom's cardiac output is really significantly elevated in that immediate postpartum period. So even though she's losing a bunch of blood, the force of the blood and the number of times that her heart is contracting and the effectiveness of that pump still remains really high. This is important because if you're working in trauma zones and you have someone who's in that immediate first couple of days of postpartum, she may have lost enough blood to be in shock typically, but won't show signs of shock simply because her cardiac output is so high in those days. Typically about 48 hours later, that cardiac output starts to drop and then generally returns back to normal anywhere from about 2 to 4 weeks, sometimes a little bit more. Pre-pregnant values, it takes really about that full 12 weeks for you to get all the way back to pre-pregnancy cardiac output levels. This is really important when we look at moms who have heart murmurs, right? So not unexpected at all after delivery because that cardiac output is still so high to hear significant sounding murmurs on moms. What we look for is that by that 2-month visit, is that starting to resolve, or does it seem like there may be a lingering heart murmur issue?